Welcome back to Wake Up Wenatchee Valley. If you are 65 or older or going to turn 65 in the not too distant future, you already know it's that time of the year. Medicare. You're going to have to make a lot of decisions. There's going to be a lot of people getting in touch with you, knocking on your door. Our plan, their plan, what's going to work. It could be a daunting challenge to say the least. But Kiersten Birke, who is the Medicare Stars Program Coordinator for Confluence Health, is going to make it a lot easier for you on Friday, the 24th day of September. Welcome to the television program, Kiersten.
Thank you, Dan, for having me.
Before we get too deep into this, what exactly does a Medicare Stars Program Coordinator do? What do you do with your day?
That's a great question. It changes throughout the year. I basically look and see areas of improvement that we can be improving upon within our valley. So our members coming in to get their colorectal cancer screenings, are they getting adequate care and services in time? So how is our access to care gaps? And on my plate currently is this event, Taking Charge of Your Medicare. So we really want to help clear up any confusion that Medicare eligible population within our 4 counties can have access to. So really understanding the Medicare basics, traditional Medicare, Health Alliance, or Medicare Advantage, and then really offering those resources. So Friday, September 24th, we'll go live with a 4-part segment on Medicare, Taking Charge of Your Medicare.
It's only 90 minutes long, and it's absolutely free. We like that. But you're the 90-minute investment time, the hour and a half of sitting through this thing, is going to be well worth it for those people who have to make those decisions, and you're going to have to make those decisions fairly soon, right?
Yes, so open enrollment for Medicare starts October 15th and runs through December 7th.
And you brought in some heavy hitters. You got the folks who know what they're talking about, don't they?
We do, yes. So we have a keynote speech by Dr. Edwin Carmack, one of our local Confluence Health physicians, and he'll be speaking on and presenting on living with and managing chronic conditions. We have local community liaison, Jessica Arroyo, from Health Alliance Northwest, and she'll be diving in deep with Medicare Part D, so D for drug coverage, which can be quite complicated.
Yeah, as we get older, almost everybody, once you get to a certain age, 65 or older, almost the entire senior population is on some kind of prescription drug. And if you don't know if you don't have your T's crossed and your I's dotted, it can be overwhelming, can't it?
It can definitely be overwhelming, which is why we really wanted to open up this opportunity, although virtual, to our Medicare eligible population. And children of Medicare recipients, they can go on and watch so they can learn a little bit more to help their parents navigate through the complicated field of Medicare.
Now, this is all day on Friday. You can log in at 12:01 in the morning if you want and participate, because a lot of the segments have been pre-recorded. You can go to the Confluence Health website right now and see some of those pre-recorded segments. Gives you kind of a head up. But this is really, the idea is to make sure you're informed as possible before you start making some very significant decisions on how you're going to pay for your health care as you get older.
That is the plan.
And by the way, Jessica Arroyo is going to be talking about Medicare Part D. That's the prescription thing that we were talking about. She's good. I've had her on the show before. She's from the Health Alliance Northwest. She knows what she's talking about. What do you want people to take away from this 90-minute virtual seminar? When it's all said and done, what do you want them to know?
I want them to know a little bit more about the options that they have within Medicare, just because there is so much and there's multiple different plans that you can choose from. I want them to really understand daily things that they can be doing from the presentation that Dr. Carmack's going to be speaking upon. It's not just about Medicare, it's about living with and managing chronic conditions. We have testimonials from our local case managers on the work that they do in coordinating with the Medicare beneficiaries and recipients, and good positive outcomes that take place between Confluence and the Medicare population.
And if you're already in the Medicare system, so you're already past that 65, you already know the ropes a little bit. This is especially critical for those people who are going to age in to the Medicare system. We've never had to go through this process before. This is really aimed, for the most part, at them, is it not?
Yes. So it is for the aging population, family members that might have a loved one aging into Medicare and kind of want to help them navigate that field. But also people that are recently enrolled into Medicare, maybe the first few years and quite not maybe understand what's offered to them and different resources that they can use.
Well, you mentioned resources. Are all the different resources going to be made available to people while they participate in this seminar? They'll be able to point and click on their computer and look at things as they participate?
So if they open up the link, it'll take them to the corporate YouTube channel, and they'll be able to watch the segments on a separate tab on that same Confluence Health website. They'll have about 7 different resources and flyers about, Medicare resources, what is case management, what are chronic conditions.
Terribly important information. And as you mentioned this, and I think it's worth repeating, Kiersten, again, we're talking to Kiersten Birke from Confluence Health. A lot of these decisions are going to be made by the adult children of those who are aging into the Medicare system. So it's just as important for the kids to get involved for mom and dad to make these decisions. So there's some guidance there. It's as much for them as it is for those people who are going into the system, correct?
Absolutely.
Yeah. So one more time, let's wrap it up. Again, it's all day on the 24th, Friday the 24th. Just go to confluencehealth.org and just type in Medicare. It's pretty easy to find. I found it, and I'm not even very bright. And it's pretty self-explanatory. It's straight through. Do you like your job?
I'm loving the job. Love the Valley. New to here, but I love everything about it.
Kiersten, it's nice to meet you. It's nice to talk to you. And again, everybody who is, even if you're 63, you can, just log in and just start doing your homework. Because the one thing I've learned, Kiersten, in all this, and I've talked to a lot of people involved in the Medicare industry and those people who offer these various plans, do your homework. It's critically important that you do your homework. This is an important decision, and this is not something you need to take lightly. You need to study it and understand before you sign on the dotted line, don't you?
Absolutely. Knowledge is power, and when it comes to your medical and healthcare needs, the more the better.
Well, welcome to the Wenatchee Valley. Yakima's loss is Wenatchee's gain. Thanks for joining us, Kiersten. I appreciate it, and I hope it goes well on Friday.
Thank you, Dan. Yeah, we hope to see everybody there. Thank you so much.
You're watching Wake Up Wenatchee Valley. We'll be right back.